Well, good afternoon, everybody. I'd like to call to order this Committee of the Whole of the Pierce County Council. It's Thursday, October 19th, 2023. The time is 1:32 p.m. Madam Clerk, will you please call the roll?
Thank you. Councilmember Campbell.
Excused.
Councilmember Kruber.
Here.
Councilmember Denson.
Here.
Councilmember Hitchin.
Here.
Councilmember Herrera.
Excused.
Councilmember Morell.
Excused.
And Councilmember Mello.
Here.
We have 4 members present.
We have 4 members present and a quorum. We are expecting Councilmember Herrera here shortly. Item number 3 is approval of our agenda. This afternoon, we have the Tacamoa-Pierce County Health Department's biennial budget presentation, as well as the Assessor-Treasurer's office presentation. Is there any objection to the agenda as presented? Seeing none, the agenda is approved. That does bring us to item 4, the Tacamoa-Pierce County Health Department's biennial budget presentation. I'd like to call on Mr. Paul Boki to help me introduce this item.
Thank you, Chair Mello, Paul Boki, Council staff. Our first, in this afternoon session, we have the Tacamoa-Pierce County Health Department presentation and then the Assessor-Treasurer's office. So the Tacamoa-Pierce County Health Department tab is under the Health Services tab towards the back of your budget book. It is section 13. There are two items in there, and one is Health Services, and that is the general fund portion. That is the portion that you'll be asked to be approving in the general fund that the executive is proposing that goes to the health department. That's the county's contribution over the next 2 years to the health department. It's $7,462,150. That is the proposed biennial transfer to the health department. And after that is the Tacamoa-Pierce County Health Department's preliminary budget and additional information, and then they also break it down by funding source. So they a lot of information actually in their area. So today we have Sinden Jitsi, worked on that name, Sinden Jitsi, the interim director of health, and we also have Ingrid Payne, the finance and operations director from the Tacamoa-Pierce County Health Department.
Thank you so much, Interim Director Jitsi. Thank you for being with us, and for you've been at the Health Department for some time in many different roles. We're lucky to have you and your leadership in this time of transition as well. So welcome.
Thank you so much, Chair Mello and members of the County Council. Again, Sinden Jitsi, Interim Director of Health at the Tacamoa-Pierce County Health Department, and I'm joined by Ingrid Payne, our Finance and Operations Director. So we're here today to present to you our 2024-2025 budget. At the Health Department, we actually begin our biennial budget development process much earlier in the year. We do work in May and June, and then bring it before our Board of Health in June and July. The board then approves it in July, and we do that so that then it can come to our fiscal agent, Pierce County, and be incorporated in your budget presentations and budget book. So because we budget early, we already know that we have changes in our budget, and so some of the numbers you might see might be different from what's in the budget book, and we'll just talk about that. But again, the numbers that are there reflect what the board adopted back in July. Before we get to additional slides, I want to give you a general overview of this biennial budget. I know we do have a couple of county council members who are on the board. So County Council Member Denson is an alternate, and Council Member Hitchin is our vice chair, and Council Member Herrera, when he arrives, is also a board member. So you all have heard much of this. This wasn't an easy budget cycle for us. You will hear later on that it does include some staff layoffs, which I'll talk about later. The Health Department continues to be in a transformational time. We will have new executive leadership, which I'll talk about. Staff are still recovering from burnout from the large COVID pandemic response that public health had. Our COVID funding has dramatically decreased in this biennial budget, and that affects our indirect funding that then supports administrative services. So we've had cuts in that. And then, we have an upcoming compensation study that we are anticipating will increase our staffing costs because we have not kept up with our neighboring governmental organizations, and have already started seeing staff leave for higher paying jobs that are similar to the ones that they hold at the health department. And then finally, anticipated shifts in our economy lead to projections of flat or declining fee-based services in the next couple of years. So all those things came together in this biennial budget, and we really wanted to make sure that we were being fiscally responsive and preparing for potential additional cuts and decreases in funding in the future. One bright side to our funding is what we call foundational public health services funding. Again, we'll talk a little bit later about it, but just want to mention it. This is from the state. The state legislature several years ago indicated and actually codified in state law a process to fully fund the need for governmental public health across the state. And when I say governmental public health, I'm talking not only about our department and other local health departments, but the state health department, the state board of health, and tribal health agencies. So this is a long-term, multi-year effort. And so we do have some additional funding, but we're not there yet to fully fund our foundational public health services across the state. So the end result of all of these dynamics is that our 2024 to 25 biennial budget shrank from about 90 million in, just looking at 1 year, about 90 million in 2023 to about 50 million in 2024. So again, we've had to make some hard budget decisions in this biennial budget. Next slide. So you see your council budget priorities. Most, if not all, of these priorities really align well with the health department's work. And so we'll try to call out throughout the presentation where we see alignment in these. For many of these areas, the health department's function is to really focus on policy, systems, and environmental changes that improve health outcomes throughout Pierce County. We also often play a convening role where we bring together partners and we prioritize community voice and do a lot of work with our communities that experience disproportionate negative health outcomes. Our vision, mission, and 5 strategic initiatives, which I'll share in the next slide or in the coming slides, have guided a lot of our challenging work in our budget because we, of course, want to be aligned with those priorities. So again, we'll call those things out as we get to those. Next slide. All right, so here you do see some of our higher level components of our current strategic plan. So our vision is healthy people and healthy communities, and we get there by protecting and improving the health of all people and places in Pierce County. You'll see our department values are equity, integrity, leadership, and respect. And our priorities we have 4. The first 3, people are healthy and safe here. People have equitable opportunities for health, and children, families, and communities thrive are really about our community-facing work, what we're doing in the community. That 4th priority, our organization is high-performing, innovative, and quality-focused. We call it our foundational priority because it really supports and enables us to better achieve those other 3 priorities. This priority, that last foundational priority, really I think you'll see it aligns with some of your infrastructure priorities, and I'll talk a little bit more about that. The other three priorities, for example, people are healthy and safe here. This aligns with your priority around homelessness. We do a lot of work preventing outbreaks among people who live unhoused. That's a population that we are keenly interested in improving health outcomes for. People have equitable opportunities for health. That aligns with their social equity and justice priority. And then children, families, and communities thrive. That really aligns with your public safety, youth and young adult, behavioral health and substance use, and housing affordability priorities. So again, we see a lot of alignment and work very closely with many of the county staff on our work. Next slide, please. So before we go into budget details, I wanted to take an opportunity to just talk about our organizational structure and especially our leadership positions, because we have had some changes in that. So many of you are familiar with the Health Department's organizational structure. The Tacoma-Pierce County Board of Health, as I mentioned, is our governing body, and the department was formed through an interlocal with the City of Tacoma and Pierce County. And so again, thank you to county council members who serve on our board. We also have board members from the Tacoma City Council, a representative from the Pierce County Cities and Towns Association, and a member from the Pierce County Medical Society, along with the executive, a representative of the executive, and the mayor of Tacoma. So I mentioned some changes in our executive leadership. So this organizational chart reflects new leadership positions recently approved by our Board of Health. So you may know that we began a national recruitment process after Dr. Anthony Chen retired at the end of June. And ultimately, our board voted to split that director of health position into two positions. A health officer position, which actually is very much, the job duties are very much guided by RCWs, that it's in state law, what the health officer, what those responsibilities, what those minimum qualifications are. And so that health officer position really follows the guidance from state law. And then the second position is what we're calling the Director of Public Health, and that person will be the main administrator for the health department. While the health officer is really focused on laws and controlling the spread and preventing the spread of disease, the director position will focus on leading and guiding the health department. So you can see that the Director of Public Health will report to the Board of Health. The Health Officer position will report to the Director of Public Health, along with the Deputy Director, which is my usual position. I also serve as the Division Director of the Administrative Services Division. And then the Director of Public Health will also oversee a division director for three other divisions: communicable disease control, environmental health, and strengthening families. So that's our new organizational structure. Next slide. A little bit more about the work that the four divisions do. I won't go through all of this, but we'll highlight a couple of areas from each division. So within administrative services, this is where we have our, I think you would consider traditional administrative services functions: human resources, IT, communications. This is where we house our health equity and racial equity and justice work. We recently reorganized that work under a new director of justice, equity, and diversity initiatives, who reports directly to the director. And then we also have our community engagement work in this division in the Office of the Director. I wanted to highlight this because this was an improvement and lesson learned out of COVID response. So during COVID, we brought on staff who were community ambassadors with lived experience from the different communities that really experienced disproportionate health outcomes, like disproportionate rates of COVID, disproportionate hospitalizations due to COVID, and disproportionate deaths due to COVID. So we actually brought on staff from those communities who could serve as community ambassadors. And it was so successful, and community told us that that's what they were waiting for in terms of the type of communication and a trusted member of their community to come and talk to them about COVID. So it was so successful that we incorporated that in our regular operations and now have on staff these community ambassadors who work in other areas and promote other health issues. The other thing I want to point out in administrative services is one of our goals is to ensure optimal facilities. And again, I know that the county is looking at your own infrastructure and optimal facilities needs. We're very grateful to the council in a previous budget for approving funding for an assessment of the health department's building. And we have been providing a lot of data in terms of space needs, staffing that we have to the architect that is contracted to do this assessment, and we're looking forward to seeing the results of that. We understand those will be presented to the council or one of your committees later this year. So that is definitely something that we're also interested in, because our building, if you have been in it, is quite old, has an aging HVAC system that we're hoping, fingers crossed, holds together while we're still in the building. Moving on to the next column, environmental health. This is really where we do a lot of our regulatory work around fees, permitting, septics, water, but it's also where we ensure people have access to healthy environments, like access to healthy foods, access to places to have physical activity and feel safe doing that physical activity. It's also where we house our family support partnership, which includes several family resource centers located throughout the county. We're very excited because we have just implemented a pilot test with a mobile family resource center. The first location was at the Star Center in South Tacoma, but we anticipate bringing that mobile family resource center around to multiple locations throughout the county. So some really innovative and thoughtful work being done there. In communicable disease control, which is the orange column, that's really where we prevent and control the spread of infectious disease. So a couple things to point out. We have our food safety. You might think of it as restaurant inspections. That's where that work is housed, because that work ensures that we mitigate and prevent foodborne illness outbreaks. We also do work around our emergency preparedness and preparation. And then again, this is where we have public health nurses who follow up with cases such as pertussis, whooping cough, tuberculosis. You might have read about a recent really tough TB case that we were dealing with, and partnering with other community organizations to help get that person treated appropriately. And this is where we do our very important immunization work. During COVID, we found that childhood immunization rates decreased, and so we are really turning our attention to bringing those back up. And then finally, strengthening families. So this is where we do work like, this is our maternal child health work, like our Black Infant Health program. And we recently received a large grant from the Balmer Group to expand and evaluate that program. So we're very excited that we'll be able to get some good data on outcomes related to that program. This is also where we do behavioral health work, like our mental health first aid and our teen mental health first aid training, which are promising and evidence-based approaches to teaching adults and teens how to help their colleagues and schoolmates when they do experience depression and anxiety. We know this is a huge issue throughout our county, and our rates have increased. In many indicators suggest that our rates have been increasing. So this is a great approach to, through kind of a train the trainer model, expand skill sets to help people who are experiencing those things. And then finally, treatment services, which I'll talk a little bit about later. Our opioid use disorder treatment services clinic is in that division. Next slide. And I'm going to turn it over to Ingrid to start going through some of the numbers.
Good afternoon. Ingrid Payne, Finance and Operations Director, Tacoma-Pierce County Health Department. As Sinden said, I'm going to walk you through a couple slides which will point out some very high-level numbers. And we'll go ahead and start with our first slide. It's the full-time equivalents. How many staff do we have on board? And you can see the total is 355, and it's pretty well evenly split between each division. And so we want to make sure all our divisions are resourced properly. And one way we were able to do that was a few years ago was realign some of these FTE counts and budget. So. During COVID, the count was up as high as 600. So it's been a drastic change from COVID to now, and we're still working and scaling down some of that COVID work. So I imagine that 355 will likely change in the next 2 years. So next slide, please. And we'll talk about our funding sources. We get money from several different places, one of them being federal monies. Last biennium, we were at 41,000, and the next biennium, you'll see it's
A million, of course.
Yes, I'm sorry.
Okay.
I said thousand, million, MM, yes. And then we're being cut. That's mostly due to COVID, the COVID drawback, so that's no surprise there. We've got the state funding. As Sinden said earlier, most of that increase is due to the Foundational Public Health Services funding. That's the effort by the state legislature to fund the entire public health system, including state Department of Health, State Board of Health, local health jurisdictions like ours, and tribal health services. Sinden happens to be a voting member on the FPHS steering committee, and that committee decides how to spend the funding the legislature allocates through a concurrence process documented in state law. So the next category is Pierce County restricted. It has increased. That increase is due to behavioral health tax and some additional dollars for our environmental health division, which includes additional sampling and code enforcement work. Then we have Pierce County Health Pool, $7,219,000, a little bit of an increase to $7,535,000. And again, that's because of a commitment by council to account for increased population growth and maintain a solid per capita. Thank you for your continued commitment and support of the health department.
And can I interrupt
Yeah.
just real quick? This may be one of the areas where the numbers are a little bit different than what is in the budget book, and so we can talk about adjustments and why that is later. Yeah.
Yep, thanks.
Cindy, while you're up there, and for those of us that don't serve on the health board, the health pool, the Pierce County Health Pool, the Tacoma Health Pool, these are done through a per capita. Can you explain for those of us that don't serve on your board?
Sure. Yes, these are the process by which this funding comes to the health department is actually documented and outlined in that interlocal agreement that I mentioned at the beginning. So when the health department was created, there was an agreement by Pierce County and the city of Tacoma to fund the health department on a per capita basis. And I believe it was at the last biennial budget, the council did increase that health pool funding amount to adjust for the increase in population. So we had not done an increase since, I think, the early 90s. And so this was, the intent was to catch up with the increased population in Pierce County and to add some funds to that health pool. I'll also mention, I know Ingrid hasn't gotten there yet, but the City of Tacoma Health Pool also increased using the same population-based formula, again, based on population increases.
And and we're going to get into the detail about the restricted funds, the above and beyond the health pool, what we want to invest in. Sticking with the health pool for just a moment, that's reflective of the population outside of the city of Tacoma.
Yes, correct. That is defined as the population of Pierce County, not to include the city of Tacoma.
So perhaps Director Robinson might help weigh in here in case he's been in these conversations. Someone like me can't help but ask, these are very well invested dollars. There's no quibbling about the importance of the investment of the dollars. Here we have Tacoma paying their fair share of health pool dollars. We have county government paying for everyone outside of Tacoma, including those that live in incorporated cities. Why can't we ask the communities of Lakewood and Puyallup and University Place and so on and so forth to pay their share of these important services, and we take on the burden of unincorporated residents?
Gary Robinson with the Finance Department. When I've asked that question, what has been shared with me is when the interlocal agreement was established, it was Tacoma and the county. At that point in time, there were not larger incorporated cities within the county, so a decision was made that the county would be making a contribution for all of the area outside the city of Tacoma. I believe that there have been inquiries, and maybe health department staff could comment on that further. I believe there have been inquiries to some of the larger cities, and there's not been commitment on their behalf to begin making a contribution. If you look at health pool contributions for other counties and other local governments around the state, there are other county health departments that are receiving contributions from more than just the largest city within their county. There are only two, I think, city-county interlocal agreements for health services, being our county with City of Tacoma, and I believe it's Spokane City and Spokane County have a similar arrangement to us.
Yet we give a voting spot to not Tacoma, not Pierce County. There's a voting board member on the Board of Health, even though there's no revenue coming from. Okay. Thank you for answering my question.
Thanks. Okay, so back to funding sources. I believe we were at City of Tacoma restricted. Last biennium, we were at 1.8 million, and we are expecting about 1.1 million for the 24-25 biennium. Also for City of Tacoma, the health pool, we're looking at a slight increase, as Sinden just mentioned, and the decrease, I failed to mention, the decrease in the Tacoma restricted is due to a pass-through contract that now they've decided to do directly with PSESD. And so it won't go through our budget process, and we won't, hit it with indirect or anything like that. So Puget Sound Educational Services District was that acronym. City of Tacoma Health Pool, we just covered that. We'll move on to licenses and permits and fees. Many of you are familiar with those. It's exactly what it sounds like. It's a lot of our environmental health work. And the food, worker cards, all the food establishments. So that's that pot of money there. We're expecting a slight increase. We're hoping and being a little optimistic that that will increase a little bit. But again, as Sinden said, that may be one of our line items that might go through an amendment process in January. So we'll keep a close eye on that. Private, intergovernmental, and miscellaneous. A lot of things go into that, and those are, you can think of that as the contracts we have with, for example, nonprofits, metro parks, accountable communities of health. We do some collaborative work with other agencies, and that's where that revenue stream comes from. All this to say, if you total 22, 23, and then total 24 and 25, the difference from this and the budget book is that asterisk at the bottom. And Paul, this is more for you. It does not include the fund balance or operating transfers in. So if you're mapping it to the budget book, that's what the difference is. Next slide, please. Funding uses. There's a lot of words on this slide. I'm not going to read every word. There's a very high level point I want to make here, and you'll see words like assessment, our assessment group. It's kind of a little bit in each different pot of money. So what does that tell us? That tells us we have to get funding, and we do what we call braiding to make programs whole. We have to take money from different sources and cobble it together to maintain some of our programs, like assessment. Assessment's not the only one, but it's a good one to point out because the entire department and the public relies on all the data we produce and the data sources we house at the health department. And really, that's all I wanted to say about that slide. There are a lot of words, but
Folks can certainly ask questions if they have any.
indeed, yes, absolutely. And if we have no questions, I'll turn it back over to Sinden. She'll have some.
Are there questions about what we've heard so far? Councilmember Kruger.
Thank you, Chair. I just was noticing the overlap between the federal and state dollars. I'm looking at the SEE, the social, economic, environmental. How do you, since that's like a double taxation collection, is that just because you need that much more to?
Yeah, so our social, economic, and environmental conditions for health is a program in which we do several things. For example, this is where some of our family resource centers are housed. This is where our Communities of Focus initiative is funded and staffed. So for example, our Communities of Focus initiative, this is where we looked at data data on where communities throughout Pierce County were experiencing the greatest proportion or disproportionate of poor health outcomes. So they are places such as White River. We also have South Tacoma, Key Peninsula, East Tacoma, Parkland Spanaway, and then Tillicum Woodbrook area, which is divided by the Interstate 5. So we work with those communities, and each community is different and has different needs. And so again, as Ingrid said, what ends up happening is based on, for example, those different needs, we will work with those communities maybe to go after a federal grant. Maybe there's a state grant through, for example, the Department of Commerce that we'll go after with the community members and then help invest that funding within the community. So where you see that, it shows that there are different types of funding. We don't use different funding for the same work. They're all different activities, different initiatives. But again, as Ingrid said, because of every community being different and different funding sources being available at different times, you'll see multiple types of funding coming into that program. Yeah.
And with these communities, I guess what I picture just from the need is like, I picture like every household has an issue, where I'm sure it's not that. They aren't all in bad health, or they aren't all.
Correct.
Is there usually like 10 or 12 places in a community where that needs the focus? Or how, I'm trying to justify or validate a whole neighborhood being in dire straits.
Yeah, well, again, sometimes this is a data limitation for us, right? We have data at the zip code level. Sometimes we can get data down to the census tract level. So you're absolutely correct. Not every household within that census tract or zip code is experiencing poor health outcomes. However, when you look at that community as a whole compared to other communities, they have a greater percentage or rate of disease happening. For example, looking at life expectancy. So life expectancy at age 18 means how many more years you're expected to live. And when you compare life expectancy rates by zip code, you see dramatic differences, up to about 15 years difference between one zip code and a neighboring zip code. And so we're really looking at those zip codes, those census tracts that have the lowest life expectancy rates, the highest rates of heart disease deaths, chronic disease. We look at tobacco use, other health behaviors, and that in looking at all of that data, you start to see trends. It's pretty incredible. If you just flip maps and you start to see these, what I call hot spots kind of popping up. And those are the neighborhoods that I identified. And so we're investing in those because we believe the need is greater, and we see that's where we're going to make the biggest difference in really improving health outcomes. So you're right. It's not every household. It's just a greater percentage of households.
It's interesting how a delivery system became a measure for health. I've had another question. So how have you measured the improvement that has been happening? So you've been doing the zip code measurement for quite some time, and I keep looking for when does that get to where they're good?
Yeah. It's a great question, and it's a challenging question. In some cases, like I mentioned, our Black Infant Health Program, we have received funding to do specific program evaluation. And so there are some instances where we have programs and initiatives where we are able to show improvements. We just had a presentation yesterday to our Board of Health around our family resource centers. And we know that through through a program called Triple P and Positive Parenting that the people who go through that, the parents who go through that program, that they have used the information and the training and the skills to improve behaviors with their kids and improved family dynamics. So we do have some information around successes in programs. It is very difficult, and the health department cannot do this alone. It takes all of our partners to come together and change long-term things like life expectancy rates. So this is tricky because I know the council and our board expects deliverables, right? Expects to see changed outcomes. And it takes decades to change those things, life expectancy. And there are things going on in our economy that we have no control over that also impact life expectancy. We know that 55% of what contributes to poor health outcomes actually relate to what I talked about earlier, those social, environmental, and economic factors. 55%. That's more than access to health care, which only accounts for 10%. So this is huge. Economics, and so this is one of the reasons why I'm pleased to see, the council's priorities around economic development. That's a huge investment in health, in people's health. And so this takes everyone coming together to help change these and improve these health outcomes.
Okay, thank you.
Yeah.
Thank you, Chair.
Thank you.
All right, let's go to the next slide okay. So critical needs and challenges, I want to highlight 4 things for the council. The first is our public health workforce. I'm sure you all are experiencing this in the county and nationwide, but we have a workforce shortage. And then you compound that with what I mentioned earlier, how our staff are really still struggling with burnout from the COVID-19 response. And so we do have a challenge of attracting and retaining staff. One of the things that we are doing to address this need is, like I mentioned, to invest in a compensation study. So we have specific data and information about some of our positions and staff job classifications where we know we are below the 50th percentile of our other local organizations' comparable positions. So we know that we will see recommendations to bring many of our salary levels up for our job classifications. So we are anticipating that. We are also participating with the state health department, who received a CDC grant around public health workforce retention, and so we'll be participating in activities there as well. But absolutely a critical need for us. And we know that investing up front in appropriate salaries and workforce retention activities will save us money in the end, because it's so much more expensive to recruit and train and orient a new person in a vacant position. The second critical need that I want to identify is, again, related to staffing, but our work specifically in sexually transmitted infections, HIV, tuberculosis, and syphilis programs. And again, this relates to what I talked about earlier with our foundational public health services funding. Funding for communicable disease control is a core component of that funding, but we have not yet achieved statewide funding to fulfill the need. So an assessment was done about 5 years ago where the state, 4 components of the governmental system, participated in an assessment of the capacity and need for the critically underfunded public health system throughout the state. So we know what it will take to fully fund communicable disease control throughout the state. And the good news is that our state legislature has made some investments in that, but we're not there yet. We haven't reached that dollar amount. So we'll continue to work with our governmental public health partners to encourage the state legislature to continue investing in public health. But this is an area where, for example, tuberculosis, we may or may not have cases that are multi-resistant, multi-drug resistance, where we have multi-drug resistance, and those cases are phenomenally more expensive than just what I would call traditional tuberculosis cases. And so it's when we do get those in Pierce County, our costs go up pretty dramatically. And again, we have some funding through Foundational Public Health Services to cover that when it does happen, but it's still a challenge and a risk for us. Environmental health. So this is an interesting situation that we're in with our fee-based services. So we, again, with our forecasting and our analysis into the 2024-25 years, we are predicting some decreased or flat permit activity, which would then decrease our fee revenue. At the same time, we've made great investments in quality improvement and decreasing our time to process permits. And we know our customers are very thankful and appreciate our efforts and have actually told us that they are very happy with how we have decreased those time frames to respond. And so we want to keep that customer satisfaction up high. We want to keep those time frames to fulfill permitting processes. We want to keep those low. But when our fees decrease and funding activities starts decreasing, our challenge is to how we can use fund balance, maybe that we've saved from previous years, but to continue that same level of staffing that allows us to provide the excellent customer service that we do. So again, that's a challenge for us. And then finally, it probably will come as no surprise to you all, but we have increasing numbers of Pierce County residents who are affected by the opioid epidemic and new types of opioids that are being used in our county. And this is really presenting a challenge for us, both in terms of we're looking for sustainable funding for our Pierce County Opioid Task Force work. So this is a collaborative that actually was started by a member of the County Council, a member of the Tacoma City Council, Elevate Health, our accountable community of health, and the Health Department. And we bring together many, many healthcare providers, other service providers, again, governmental representatives, leaders in the community throughout the county to come together and identify priorities for the county to improve our systems to address the opioid crisis. For example, there are committees looking at care coordination and how do you get people who are ready to quit into services immediately, because that's what we know will help. You get people immediately when they are ready. We call it the right place at the right time and get them into services. So we are looking for sustainable funding to keep the opioid task force going. In addition, we're looking for one-time funding to facilitate integration of a previously funded pilot project called Meds First. So the purpose of Meds First was to provide just in time when people are ready to quit and get care. This program allowed them to just show up in the health department parking lot and get buprenorphine immediately, start treatment for opioid use disorder, and then have a nice warm handoff and guided path to our regular treatment services facility. But it enabled people to get that medication for opioid use disorder immediately. Our usual substance use treatment services provides Suboxone and methadone. And those medications are highly regulated by the federal government. And so we are not allowed, you have to go through some assessment of the person, and there are some steps to take before you can immediately administer that medication. The Meds First program allowed us the opportunity to do that, to provide medication immediately. Unfortunately, it was a pilot program, a partnership with the University of Washington, funded by Healthcare Authority. That funding ended 9 months early. So our plans were to integrate that into our ongoing services, and so the funding was cut short before we could do that. We are still attempting to do that, but we're looking for some one-time funding to help us do that integration more smoothly. It includes including staff people who can, again, provide that almost like a healthcare navigator service to people who come to us and say they're ready to quit immediately and want to get on medication immediately. So those are two very specific funding needs that we have for the upcoming biennium.
I'll ask you to pause.
Yeah.
Thank you. Picking up where you left off, what you were explaining about the healthcare navigators for the opioid epidemic, for that population where you found an effective service, is that something you would anticipate applying through the opioid funds,
The settlement
settlement
funds?
funds?
Yes, definitely for the Pierce County Opioid Task Force. That's what we would look for opioid settlement funding. We would also absolutely apply for that one-time funding. So I think both of those could be fulfilled. The one-time funding need is fairly urgent because we have a real need right now through June of 24 to help us continue to fund or integrate those services.
I was looking to Councilmember Hitchin to make sure she understands the need. She assures me she does. So I'll be sure to hear from Councilmember Hitchin about that and many other
Thank
things.
you.
Thank you. I do have another, before we move off this slide, I also just wanted to thank you for laying this out so clearly. A lot of need here in public health. I have to express my strong concerns, and I'm glad that a couple of Board of Health members are here as well. I've talked to them about this individually as well, but Madam Director, I know you share the concern for our HIV/AIDS community. There's a significant amount of transition going on right now with the Pierce County AIDS Foundation, to say the least. Luckily, the State Department of Health is stepping in immediately to take some of the case managers from PCAF, the Pierce County AIDS Foundation, to the State Department of Health. It's not a very easy transition, as folks can imagine, but I think the Department of Health is doing what they can. That doesn't mean it's great. And a lot of folks the 700 clients who are clients of PCAF need these case management services to stay on their meds so they don't so that they don't spread the disease, and all the other care they need to stay stable so that they can stay healthy. This is a really acute problem, as I know you know, but I had to say it here in this setting. It's very serious. The lack of having a stable organization like the Pierce County AIDS Foundation, because of the instability in their leadership right now, that's saying it diplomatically, it is very serious. And we can see not only the 700 folks under the care of PCAF really unstable, but them not having the capacity to do prevention of the disease. We can see HIV/AIDS cases rise and rise significantly without an organization like PCAF doing their day-to-day work. So this is really serious in my estimation. And I just wanted, since you're here, we know State Department of Health is stepping in as they can, but would like to hear from you about what our local Department of Health is doing in this emergency.
Yeah, thank you for bringing that up. I agree that it's an acute, very troubling situation that we're in. We have been a part of the meetings with the State Department of Health. In addition, PCAF was also providing similar case management services to 2 or 3 other counties as well. And so we've been coordinating with the local health departments and jurisdictions in those counties as well. My understanding from the State Department of Health is that they are, as you said, they are transferring the care of these clients over to the State Department of Health. They are in the process of hiring case managers to do this, and I know that they were hopeful that perhaps some of the case managers from PCAF might apply, for those positions to provide a continuity of care. So hopefully some of that is happening. Again, our primary concern was to ensure that there was a short-term solution to the care management of the patients. Our second concern was, as you mentioned, that this is a long-time valued community partner, and so doing what we can to support the process of that organization finding its footing and remaining a stable community partner in our area. So we are a part of conversations to ensure the continuity of care in those situations, and also communicating with our other local health jurisdictions who also have clients in need of those services. So yeah, absolutely agree with you, and we are watching closely to ensure that the continuity of care exists and happens.
Thank you. Any questions about what we've heard so far before we continue with department priorities and strategic initiatives? Let's move on.
Okay, next slide. All right, so these are our current, what we call strategic initiatives in our current strategic plan. I've talked, several of the programs that I've mentioned and illustrated fit within these. Again, this was another part of our strategic plan that really guided and informed our development of our biennial budget. I've talked about communicable disease. I'll just mention that 3 indicators are around syphilis, because we are seeing an increase in syphilis cases, including congenital syphilis. And so we're concerned about that. Immunizations I talked about, and tuberculosis, as well as the COVID response. For community behavioral health and well-being, I talked about teen mental health, some of those efforts. Again, thank you to the county and the behavioral health tax initiative that funds many of these needed programs out in the community. This is another area where I'll mention that we use the braided funding that I was talking about, because we want to make sure that the Pierce County tax dollars stay in Pierce County and are not used for City of Tacoma. So we have other funding from the City of Tacoma that allows us to do similar programming within the city limits. But we're very careful to make sure that the funding from the Pierce County Behavioral Health Tax stays in the county, not in the City of Tacoma. Healthy, resilient children and youth, again, I mentioned some of this work. And health equity and racial justice, I'm really going to talk about in 2 slides around diversity, equity, and inclusion. So next slide, please. And I'm going to turn it back to Ingrid to talk about some of our previous activities using ARPA dollars.
Okay, so most of our activities funded with ARPA went straight to COVID. You've seen a lot of this information in the past with our COVID updates. And really, this is a snapshot of the money provided and where some of the activities specifically lied. So for the COVID-19 response, the largest bucket of money, that 10,785, that went to cover the investigations of all the outbreaks we've had, vaccine, test kits out into the community, locations in Lakewood to provide these services to communities, countless data and dashboard updates, and have to give our data team and our communications team big kudos. Our web traffic just went through the roof during COVID, and our communications team has won 2 awards now nationally, so very proud of them getting the word out and making sure people stay healthy and safe and know what to do and where to go. Then isolation and quarantine is exactly what it sounds like when folks were sick or a family member was sick and didn't have a place to isolate and quarantine. We provided adult family homes so they could quarantine safely and stay away from their families or infect others that they lived with. And a lot of that included pharmaceutical support. Some of them had medical wraparound services. And so far, we've got about a little more than 1,700 clients that we've served.
Excuse me.
Yes.
I want to make sure we're tracking properly. What you're walking through here on this ARPA slide, these are dollars that have already been spent. These are not new ARPA dollar requests.
This is not new.
This is a report out on how you used ARPA dollars.
Yes, sir.
Want to make sure we're clear.
Yep.
For other departments, we're hearing updates about new ARPA money or reappropriated ARPA money. This is ARPA money already spent, not being asked for.
Right.
Okay, please move quickly
Yes.
through this.
School support, that was a $2 million contract, $2 million, and most of that went to a contractor that helped us support the schools that signed up for the help. And you can see I've listed them there. It was Tacoma. We did offer it to everyone. These are the ones that raised their hand and said, I need help. I need help gathering the data and meeting all the requirements placed on me during this COVID crisis. So that's exactly what we did. We provided all the support to each school. Each service was individual to that school and their need. Tacoma, Bethel, Bellarmine Prep, Clover Park, Franklin Pierce. We also had some CDC fellows that CDC provided to help support with that effort. And that was at no cost to us. CDC footed the bill for that one. Staff resiliency, $1 million went toward that staff resiliency. We were able to partially fund staff resiliency coordinator. Again, we go back to that braiding of funds. So this did help us bring someone on board and help our staff and our teams get through some of the turmoil that came with downsizing and minimizing a lot of the work with COVID and just frankly the trauma of the long hours, long days, the sad families, sadness. So we're very grateful for that. We were able to pay out kind of a one-time thank you to all of the staff that was either employed by a temporary agency or by the health department proper. It wasn't a whole lot of money, but it was a little bit of thank you, and we appreciate everything you've done over the last 2 or 3 years. I wish it could have been more, but we did the best with what we had, and we're very appreciative of that. The last bullet on this chart is family resource centers. Can't say enough about our family resource centers. I've listed the locations here, Bethel, Eastside, Franklin Pierce, Hilltop, Lakewood, Key Pen, Sumner, Bonnie Lake, Ording, and of course White River. Each one of those family centers looks very different from the other. It reflects the need of the specific community that they're in. So again, thank you very much for giving us the money to help us support those family centers during the COVID crisis. And that's all I have on that slide, unless there's any questions.
I don't see questions on that right now.
Great, thank you.
Next slide, please. All right. So a little bit about diversity, equity, and inclusion at the Health Department. I know that these are questions that you pose to all the Pierce County departments, so I'll kind of go through these. How have you applied DEI principles to your budgeting process? So we have been working for many years to have a transparent budget process. So, for example, we have all of our budget meetings open to our staff who want to attend in person or virtually, so that it's a transparent process. We also have staff budget representatives from each division, so people who are not normally part of the decision-making process, and we invite them to learn about our budget process and actually have a vote at the table to determine how we spend money. We also are anchored in our racial equity and justice principles. So, for example, we have a scoring process where we entertain new funding proposals, and we rank them based on alignment with our strategic plan, and then we added some questions about how well those proposals achieved health equity and were rooted in racial equity and justice principles. So those are a few ways that we've applied those principles to our budgeting process. Next, specific areas or programs where we've implemented to advance equity considerations. So as I mentioned, we actually have had a health equity program for about a decade now at the Health Department, and we really focus on those communities of focus that I mentioned earlier and investing in those communities, having a community-driven process, so it's not the Health Department coming in and telling the communities what they need, but it's the communities themselves telling the Health Department how we can help them improve the health of their communities. In addition, we have done work around health in all policies. We call it our Health Lens Analysis tool, in which all of our resolutions that come to our health board go through this process where we consider what the impact of every resolution, what social, economic, and environmental impacts there are to the community. And then we, as I mentioned, we did invest in a new Justice, Equity, and Diversity Director position. This is the first time in about a decade that we've added a position to our management team, our senior management team. And again, this was through an effort, collaborative effort with staff, talking with them about how we can better invest in equity and racial equity and justice, and that's what led to that program. And then I already mentioned our new community engagement program, which came out of lessons learned from the COVID response. What steps have we taken to ensure that our budget doesn't cause disproportionate harm? Again, our health in all policies approach with any kind of policy document, and I believe our budget is a huge strategic policy document. So we use the questions on our Health Lens Analysis tool. I think it's comparable to the equity review process that the council does for your resolutions. We apply that to our budgeting process as well. And then how have you engaged with or considered the needs of underserved communities? So again, we continually listen to the voice of multiple communities, not just the communities of focus, but with our community engagement work, they're out there talking with parents, community members, students. We've even done listening sessions at schools, and we use their information, what they say their needs are, in helping us develop our budget. In addition, we do a lot of data analysis around health equity. I mentioned the different outcomes where we're looking at differential proportions of poor health outcomes, and then we take that into consideration when developing our budget as well. And that is it, other than just to, provide a bit more detail. I mentioned at the beginning that this was a tough budget cycle for us. We did and do anticipate layoffs that you'll see on the next slide. When we first budgeted, developed this budget back in June, we anticipated a reduction of 30 FTE. And at that time, we anticipated it would be 15 vacant positions that we wouldn't fill and 15 filled positions. The good news is that since then, we have received additional grant funding and we have staff retirements and attrition where we have only had to lay off 3 staff people. That's still 3 too many, but we were happy to get that down from 15. So we have announced 3 staff layoffs. 2 of those are in our fee program. So I mentioned how we're trying to balance that reduction in anticipated fee revenue, but keep staffing up. We did have to reduce by 2 FTE in that area, and then 1 additional administrative services position laid off. And again, we do have program areas impacted in this budget. Those vacancies that we weren't able to fill are in some of the areas that are on the screen. And I think that's it. Happy to answer any other questions.
Thank you. Questions by council members? Councilmember Herrera? No? Who has Councilmember Herrera's microphone?
Oh, maybe.
Councilmember Denson.
Thank you, Chair. The 2 layoffs, which positions are those?
Again, these were, so there were 3 layoffs. One was it was an IT analyst in our IT department. That was the administrative position. Again, that was really due to the dramatic decrease in COVID funding affected our indirect funding that were then able to apply to administrative services. So we needed to take a reduction there. And then the other 2 positions were environmental health services analysts. We have a 1, 2, 3 level. I believe they were both 2s, but I could double check on that. Again, in our fee-based programs, anticipating decreased requests for permitting.
Okay, I had a call yesterday from an individual concerned about the individual well program. Are there changes in that program or were there significant cuts to staff in that program?
Let me follow up with that and I will get back with you. Again, I wouldn't say we have any significant cuts in any of our environmental health programs, but I will double check to see if either or both of those positions were in the program where we do permitting of wells.
Okay, they were just concerned about water quality and
Sure.
obviously you guys
Sure.
role in that. And then I'll just make a comment. We had a conversation with Planning and Public Works similar to this. Was it just yesterday? I don't know. It seems like a million years ago. And the conversation was around sometimes the attention and priority gets put on new permits, so new septic, new wells, and the code enforcement in the case of Planning and Public Works, and you all have your own enforcement in regards to septic systems, and for one, gets put off or sometimes doesn't happen. Can you just speak to how you're going to retain your activities around enforcing and making sure in environmental health we have healthy septic systems and people are not developing too close to water systems, things like that?
Yeah, I mean, again, I'll say that we did a lot of projections and forecasting to look at what we believe will be the numbers of permitting requests that we get in all areas, whether that's new permits or ongoing maintenance. And we believe that we now, have the right staffing level. But again, this is one of those challenges and needs that I identified because it's always a little tricky to make sure that we do have the right staffing levels. And what we're really focused on, and I can send you a link, it's on our website, but we're really focused on our response time to all permit requests. So on our website, again, I don't have the link memorized, but I can get that to you. We show our response time, the average response time to these different types of permits that you're talking about. And our goal is to get them in the green area where we have set goals with our advisory boards and customers for where we want to be. And so our goal is to be in the green, which we do for the most part. There are a couple areas that are in the yellow that we're still working on. So I can tell you that our commitment is absolutely to continue responding to new permit requests, but we continue to keep pursuing the regular ongoing maintenance. For us, that's really where you get into the preventive part of our work, and that through ongoing maintenance and regular check-ins and updates, that's where you catch things like failing septic systems, and where we can come in and work with families and homeowners for different options on what they can do to correct those. So it's absolutely a priority for us. I will say that during COVID, that was a challenge for us to keep up with those ongoing maintenance kinds of permits, and we had to make some tough decisions about what to prioritize and what not. But now that we are out of the response, we are back to fully implementing all of our permitting activities and keeping up on those. Yeah. Yeah.
Thank you, Councilmember Coover.
Thank you, Chair. Could you explain a little bit more about the community ambassadors?
Sure.
I haven't heard of that, and no
Yeah.
constituents.
I can give you an example of one that we recently presented to the Board of Health. So we have 2 staff people who are from the community ambassadors for the Ukrainian committee or community in Pierce County. So as you may know, we have many Ukrainian refugees who have come to Pierce County. And so these are 2 women who are Ukrainian. One came to Pierce County decades ago. The other one just came last year, and through everything that's going on in Ukraine right now. They are members of the Ukrainian. They are Ukrainian, and so they are. They have been able to promote some key health messages, increase vaccinations among the Ukrainian population in Pierce County, which has a very high level of mistrust for government. And a lot of that has to do with what's happening in Ukraine and what they have been through in their home country before they immigrate to Pierce County. And so by having community ambassadors actually from the Ukrainian committee, they are able to establish trust much better than if I went to the Ukrainian community in Pierce County or any of our other staff people who are not Ukrainian. And they've been able to bring much higher numbers of our current residents in Pierce County who came from Ukraine to different health events to get tested for COVID, to get vaccinated, childhood vaccinations. So that's an example of a community ambassador.
Okay. And I see so much focus on community versus what about the individuals that are self-sufficient, but they need health department something. What's for them?
Yeah, and this may be just semantics. I mean, communities are made up of individuals. So really, when public health is at its best, I believe, when we can implement population-based measures like policies and systems change, because it affects many more people all at once. But you're absolutely correct that communities are made up of individuals. And so, like the Ukrainian community ambassador that I just talked about, right, they brought individual families to different events to get them vaccinated. So absolutely, these are services for individuals. Again, oftentimes we talk about the community level, or we focus on policies that will improve health for large populations of people.
Thank you.
Yeah.
Okay, thank you, Chair.
Thank you, Councilmember Hitchin.
Thank you, Chair. I know that recently in the Public Health Advisory Board, we were talking about the policy level of really looking at public health and programs like this being something that if we bring something out of COVID, that's something that we're thinking we want to recommend that we keep going at a statewide level because we found it so important with messaging and trust building. So I was pleased to see it in the budget when I first saw this and pleased to hear it again with my colleagues. I just had one question, and I guess maybe I just hadn't seen it presented this way, and I felt that I knew enough about it that I didn't actually go to this page until a couple days ago. But in substance abuse services, when I go back to 2020, which seems forever ago, we had 47, according to our budget book, we had 47.58 people doing that work. And then it went up in 2021 during COVID, and then it dropped by 13 in 2022 and 2023, and then we're going up by 1. So I'm just curious, what changed was 2020 and 2021, was there CARES Act funding or something? Like, how did we get this nice little boost?
Really what happened there was a change in how substance use services are funded by the state and regulations that came in and really a new funding mechanism for substance use services. At the same time, and this is a good thing, there were directives from the state healthcare authority to begin to integrate mental health services into behavioral health services, and now they're looking at integrating physical health services into behavioral health services. And so the drop that you see, if I'm remembering correctly, really had to do with the change in regulations and funding that occurred. And so we had a drop in funding and then a corresponding drop in staff. And we have been working really hard negotiating with managed care providers in the state and with healthcare authority to identify what we can get paid for, making sure that we are including everything in our billing processes to maximize what we're allowed to get paid for, reimbursed for. We actually have brought on a consultant this year to continue to help us with that process. So we experienced a large funding cut with the change, and we've been working our way back to levels that we had before.
Okay, thank you. That makes sense. Thank you, Chair.
Thank you. Madam Director, in the executive's proposed budget, it eliminates the American Rescue Plan Act investments that were originally appropriated for the health department and reappropriates those for other purposes that he proposes. In your professional estimation, the dollars for COVID response are no longer needed?
I will never say that COVID dollars are never needed. We continually have needs to continue our response activities. I will say that we have received some funding from the state health department, through June of 2024. Beyond that, we do not have any committed COVID funding. And so that's where I would be more concerned, is after June of 2024 for ongoing COVID response needs.
What does the COVID response look like today?
Yeah, obviously it looks different, but here's an example. We're still producing data and surveillance on COVID, but compared to the height of COVID, where we were producing daily updates to our COVID numbers, now we're looking at every other week providing a COVID data update. So we have reduced our epidemiologic capacity for COVID, so we aren't reporting as frequently changes in the COVID data. So that's one example. We are still doing messaging, communications around COVID. For example, when the new vaccine came out this fall, encouraging people to get this new COVID vaccine, and also talking about other respiratory illnesses that really people are also at risk for. for, like RSV and the flu, influenza. So we talk still about the importance of getting COVID vaccines. We still do community engagement. We are still out there in those communities disproportionately affected by COVID with test kits, we're talking about vaccinations, et cetera. The distribution for COVID vaccines is different now, and we're advising people to go to their healthcare provider, or many of our local pharmacies are doing incredible work providing COVID vaccine to the community.
I just got mine on Monday.
There you go. Thank you. Good. So again, our work is continuing. It is with much reduced staff. Oh, the other thing I'll mention, we are still very much investigating outbreaks, COVID outbreaks. Long-term care facilities continue to be the places where we see the most and the largest outbreaks. And so we still have staff who are working very closely with long-term care facilities throughout the county on mitigating, preventing COVID outbreaks. We're still communicating with schools. We still get a lot of questions about how to handle certain situations where someone shows up and they've been diagnosed with COVID. So that's the type of work that we're still doing.
And right now, you just summarized a bunch of work, and right now that's being mostly funded through state dollars that you've received?
Yes, and I'm looking at Ingrid just to make sure I'm being truthful. Yes, so yes, we do.
And obviously, you have a state appropriation through the state biennium.
We do, but it ends June, right?
June 24.
Right.
Ends, yeah.
What's the likelihood of new dollars in the new state biennium?
So that's really hard to say.
Here you go.
We do keep checking on that. I keep checking on it. And there's no commitment from the federal level yet to state, so they're, hedging. It's non-committal at this point. So, the other piece that we still continue to do and we need to do by RCW is that isolation and quarantine. That's a responsibility of public health. So we do continue to do that as well for COVID.
Can you get us a summary of those functions that you just went through and what the cost is from July 1, 2024 through whatever period you think you would need to continue those? And also, in the executive's proposal, there's an elimination of, in the sheet that I have in front of me, $604,000 for family resource centers. There's ARPA dollars for family resource centers. Does this ring a bell?
I believe it applies to the slide that Ingrid went through, that approximately where we had previous funding for family resource centers, and so my understanding is that that funding would now go away. So this was previous ARPA funding that we had that is now proposed to go away.
That's what I'm asking about.
Yes.
What did you do with these resources? What would you do if you had the $604,000?
We would provide more mental health, behavioral health services through again, mental health first aid. We would provide additional triple P and positive parenting services to clients. We would resource the mobile family resource center that I talked about. We would have greater capacity to staff that. Right now, we are patching together from existing staff to staff that, so we would be able to take that many more places throughout the county. So that is absolutely what we would do. Our partners through the Family Support Partnership have a list of needs, and we try to fund those as we get funding.
The executive's proposal zeroes out all public health, further public health investments. Did you request that of the executive?
We did not.
Did the executive confer with you about what these unspent dollars from the previous?
I'm going to, not with me, but I will check with Ingrid.
Yeah, no, I did get an email at some point letting us know, I think Julie DeMuth, that,
That's Julie.
oh, I didn't see you come in. That there was going to be a cut in one of those categories. I can't remember exactly which one, but maybe family resources. That was a while ago, but that was the
But you
only
didn't
notification.
request these. You didn't say we don't want to do these programs anymore. The
No,
community
sir.
doesn't have the need anymore. You didn't.
No,
This
sir.
didn't come from you.
No, sir.
Want to make sure we understood that. Thank you, Councilmember Krueger.
Thank you, Chair. I just was wondering, do you track adverse reactions to any of the shots?
So we don't personally, that's done at the national level, so the CDC tracks that. Yes.
So locally, they don't give you a call and you don't manage tracking that and refer them to the state or to the
You know,
feds?
we coordinate, we certainly refer people to them to report adverse reactions. So if we receive any calls or know of anything, we definitely refer people to them.
Okay.
Yeah.
But you're not like.
No,
making a
we
tap.
don't have the authority, at the local level to do that.
Okay,
Yeah.
thank you. Thank you, Chair.
Thank you. Are there any other questions by council members? Well, I want to thank you for coming to explain the investments that we make. While the county council does not set your budget and govern you, we are a very important contributor to an investor into the health pool and to your operations. So thank you for taking the time to come and explain the investments that are made by the public. I know Mr. Robinson had to leave for another meeting, but I'm glad he's asked the questions that were on my mind about how maybe we more fairly resource the health department so that Pierce County is not taking on all of the responsibility of funding the health department for everyone outside of Tacoma. That doesn't seem fair to me. And I can't help but think of a model more like the Clean Air Agency funding model, where the county and all the cities proportionally pay for the costs of the Clean Air Agency, and a governance model more like Pierce Transit, where there are representatives from cities and towns and the county and the biggest city, and it's a shared governance model that's proportional to the people paying the tax bill. Ms. DeMuth, I don't know how to. I can imagine how to pursue that conversation, but maybe more, we should have more discussion with the executive's office, Board of Health members, about how to pursue that with our city partners. And no one wants to pay more, but I don't think it's fair for the county government to have all of that responsibility. A tough conversation to have with our city partners, but I think it's a fair conversation to have. Councilmember Hitchin, perhaps I caused.
I just thought I would share that I'm going to, Chair Ushka and I have had several conversations about cracking open the ILA. It's been a long time. We know some of the rules around interlocal agreements and contracting, and contracts like this have changed. We're in the middle of looking for a new director, so we're going to focus on that and our energy on that. But I think in 2024 that there is some plans to kind of break that open and take a look. And so if we're changing that, the other thing is that the state has changed how health departments and districts work, the way they're kind of monitoring, supervising from the state down, and looking at our current model. Is it the right model for the county that will be at 1 million people within 5-ish years, depending on which numbers you believe? So looking at that, is it the right system for us, and is it getting enough funding to meet the needs in the way that makes it so that we can actually meet the needs of our very dynamic and large, both geographically and population-wise. And so I think that definitely is a 2024 priority of the current chair. She's mentioned it many times, and then something else happens, and so we just haven't been able to take it on.
That's great to hear. Thank you for sharing those priorities from the governing board of the health department. just putting a fine point on it, the county's portion of the health pool is $7+ million. City of Tacoma is $1.4-ish million. This is, I'm sorry to make such a point of this, but it's getting unaffordable for the county. We got to do something about this to make this more affordable and more fair. Thank you for hearing it. Thank you for prioritizing this at the governing board of our local health department. Thank you for taking the time to present with us. Thank you for the very hard work public health officers do on our behalf. Smart work, very relevant work. We're very, very appreciative.
Thank you for inviting us to present.
Thank you. I'm going to ask us, I'm sorry, Mr. Assessor-Treasurer, we've been at this for a while today. I'm just going to ask us to take a 5-minute recess so folks can do what they need to do. Are you okay with that or no?
Oh, yes. I need a human break.
Let's try to take a 5-minute recess. Well, welcome back from the council's afternoon recess. We are back in our committee of the whole, and I'd like to ask Mr. Boki to help me introduce this next item related to the Assessor-Treasurer's Office's biennial budget recommendations.
Thank you, Chair Mello, Paul Boki, council staff. This afternoon, we have the Assessor-Treasurer's 2024-25 budget request. The Assessor-Treasurer's office budget can be found in the General Government tab right at the front of your budget book in the first section, General Government, and it is actually the second item beginning on page, so it's section 5 beginning on page 3. You've also been provided, and he does have several items in his decision packet also, and that is at the top of page 1 of the general fund decision packages.
Thank you. I'd like to invite up our Assessor-Treasurer, Mike Lonergan, to the podium to begin his presentation. Thank you for making time to be with us.
All right. Thank you, Mr. Chair. I'll keep my water handy. The last time I was here, I didn't bring water forward, and then I coughed my way through my presentation. A lot of times when the council, of course, is dealing with our work in property tax, it's on the revenue side. So not too much in the future, you'll be voting on the highest lawful levies for the general fund, the county road fund, and the conservation futures fund. And also, I know sitting as the flood control district board, you'll vote on that tax as well on the revenue side. So our office performs that function of raising funds for the county, is one of the major sources of this whole budget that we're talking about. But today, of course, we're going to talk on the expense side. I will say that the county's budgets for road and general and everything combined is about 1/6 of the money that we do raise. I do have people say to me, well, what does the county do with all my tax money? Well, the county only gets that 1/6 when you put it all together, so the rest is going to many other taxing districts, about 75 of them around Pierce County, and so we're performing those important functions. I did want to thank council members for taking a real interest in the Assessor-Treasurer's office this past year. We've had a number of your members come to our, either in person or remotely, our quarterly staff meetings, where you actually hear in about an hour and a half a whole lot about what this department does and how busy we are. And then others we saw when we did have our outreach to the community with the South Sound Housing Affordability Partnership, and even the mayors of some of the towns participated with you, and we appreciated having you there as we met with hundreds of the senior citizens and disabled people who are very interested in the property tax exemption. And I'll talk a little bit more about that as I go on, because that's going to be a big impact coming in 24 and 25 for our department, the biggest that we've identified, and I'll explain that. My right-hand person, our accounting assistant, who has been here at past budget times, Paula Christman, is home with the crud today. I can't define exactly what it is. We encourage all of our staff to get the flu shot, so I hope it's not that, but she's really feeling poorly, and she has made the effort to be online and can be prepared to answer questions, but I don't intend to ask her to do anything. I'll take down any questions I cannot answer, and we'll take them to her when she's feeling much better.
Mr. Weinsbury, you have the name of that person?
Oh, Paula Christman.
We'll bump her to panelist in case we do need Paula's assistance.
Okay, very good. And of course, she works with Julie's team, not only at budget time, but all year round. There's constant work tracking the budget and staying on target. And so they work very well together. Okay, I'll jump into the slides now. Thank you very much. Council asked how we are addressing the budget priorities that you've already identified, and there are 10 of them, as you well know. I highlighted 4 of them that I thought were especially appropriate to the Assessor-Treasurer's office and our work. Of course, Fair taxes are very important because it is an important expense, a significant expense in owning a property, be it a home or a business or an apartment building, whatever it might be. So this is very important to us, and it is our bread and butter. If there weren't significant amounts of new housing being built in Pierce County all the time, then our revenues wouldn't be increasing at the rate that they are. But one important aspect of this is the multifamily exemptions that those who are building apartments, whether they offer set-aside affordable housing or not, they can qualify in many parts of the county for the multifamily exemption. And that does help make housing more affordable by basically delaying for 8 or 12 years the payment of property tax on all the improvements to that property to make more housing. The next category I marked is public safety, and this is really thinking in terms of where our funds go as we collect them. As I mentioned, 1/6 goes to the county, and as we're especially aware of at budget time, a lion's share of that funding goes to law enforcement, sheriffs, corrections, prosecutor, that whole process. But beyond that, the county, of course, has different sources of funding, major ones, not only the property tax, but the sales tax. When it comes to our fire districts and our emergency medical service, it is the property tax. That is how they're funded. And so on my way to this meeting, I pulled over for emergency equipment responding to something pretty big here in Tacoma because they were coming from two different directions. But every time you see that, a red vehicle out there, that is property tax at work. The next item I marked is the social justice and equity. And this does speak directly to our senior and disabled exemption. We don't create it. You don't control it at the county level. It is a function of the state legislature. And we will talk about the major changes they've made that's going to be a real challenge for us in this next biennium. But that is an important way, of course, of keeping people in their homes where it becomes a factor when people have limited income or their income stream ends, they cannot work, then we do not want one person to be forced out of their home by inability to pay their property tax. The final one I marked is youth and young adults. County gets about 1/6 of the funds that we raise, but school districts, either directly through their bonds and levies or through the state school levy 1 and 2, get about half of all the money that is collected. And it varies by district depending whether they do have a current bond issue or not, what their levy rates are, but it is significant. It's one of the major reasons that our office exists, is to fund education in the state of Washington and, of course, the numerous school districts that we work closely with here in Pierce County. So, having highlighted those, we'll move on. The next item, which you obviously can't read because it's fine print, but we've removed the names here and just put the official identification position numbers on here for their various positions. And many of them are in the category of office assistant. And if you look in the yellow area, most of those are that. Many are appraisers, 1, 2, or 3 in the purple area. And then we have just 3 people who are extremely important to our operation. Beyond the county's excellent IT department, we have 3 information managers working for us because our whole product is data. In Public Works, they use computers, but they have dump trucks and so forth. We just deal with data. And so that team applying many improvements every month, we're coming up with ways to deal with our data better and get more accuracy, more speed, better results. So we need them. I'll go through basically the 12 different functions of our office here in a minute. So here I just want to highlight that we're very lean up at the top of the org chart. There's only really 4 people. I have an assistant who helps me in many aspects. I mentioned our accounting assistant, Paula, who is very important to this process and handles not the billions of dollars that go through our office by way of taxes, but handles every other dollar that's used to operate every aspect of the office. If we need to order paper, whatever, she's doing all that. And also, we don't have a separate person for personnel matters, so she's handling all those changes as people move through the steps in their employment. So very lean. The only other person I included in that top echelon is our administrative officer, who you see overseeing all these other departments that are in the yellow. As I mentioned, many are office assistants, but we also have a cartography department, so we have cartographers working for us as well. I want to stress that because our whole business is meeting deadlines, both on the assessor and treasurer side through the year, there are certain milestones that we must hit. We are governed largely by the Department of Revenue. We deal with them daily in different aspects, and they actually participate in our quarterly staff meetings. We're one of the larger, would be the second largest in the state doing what we do, so they have several of their staff always participating and working closely with us. But when those deadlines are approaching, right now, we're getting close to Halloween, so that means we're getting close to the second half property tax payment deadline. So every day it's ramping up at our front counter, in our mail, our online payment systems. We had a downtime with our online payment system this morning for a short time, and we worked with a vendor who got that fixed quickly, but we feel it. You know, our other phones start to ring when that happens. I can't make my payment. So we shift from these different teams that you see as people need more support in a given area. We're not sitting waiting for our deadline to come. We're crossing over and assisting other teams to meet their various deadlines throughout the year. So I'll go on to the next slide. And again, we are one of the core functions of county government. The assessor up in Snohomish County said, Mike, you always need to remind your council of this. There are many interests, many needs in the community, but why do we have counties? The assessor and the treasurer, the auditor, the clerk, the prosecutor, the medical examiner, these positions are why they made counties. They wanted government to be close to the people to provide those important functions. And so my office combines 2 of those, the assessor and treasurer. I hasten to say that I am not, and I'm thankful I'm not, the treasurer in all aspects of the county. I'm the treasurer as regards everything to do with the property tax, collecting the tax, billing the tax, foreclosure on those who don't pay the tax. That's all my job. But, you know, thank God we have a good and excellent finance department. And even though Gary isn't here right now, I'll say that there are other functions in other counties investing the county's funds, paying the county's bills. I do not do that. The finance department does that, and we work closely with them. We share one of our computer systems between them to accomplish everything we do relating to the property tax. But here what you see is the 12 functional areas. Residential appraiser, if you saw it on the earlier slide, that is our largest team. There's over 20 people on that team. Then we have statistical appraisal, which is a small but mighty team, because our job, unlike a private or fee appraiser who at the time of a sale of property works for the seller or buyer and determines the price at that time for that sale, we are doing mass appraisal. So every year we are appraising 330,000 pieces of property. What is their value for this tax year? And the statisticians take the data that's gathered in the field and put it all together and come out with those values. And then we are measured, our work is measured by what's called a ratio study. What properties actually do sell, whether it be commercial or business or residential, we compare those prices that they sold for with what we had them valued for. How close are we? That is our ratio, and every assessor in the state is measured by that, and we do very, very well coming in on target. Next team we have is commercial appraisal, also a large team. There are 10 people on that team, and they are appraising every business property in the county. And we classify apartments as commercial, not residential, for purposes of taxation. They are a business, so they also are dealing with the tremendous growth in apartments that we're seeing. Appeals is a separate group, a small team that deals with everybody who wishes to exercise their right to appeal to the Board of Equalization. And we're just starting their season. Not a big season for us, fortunately. Only about 1,200 appeals out of the 330,000. So less than last year. And I think that's a good sign that people think we're, for the most part, doing our job correctly. Let's go to the next slide. I'll keep moving here. Our customer service team is the people you would see at the front counter, collecting large amounts of money that do come through, and also the team that is in our phone room that you don't see, that are dealing not only with all the incoming calls with questions, but also are doing computer chat more and more with people wanting to contact us in that way, similar to just texting somebody and getting your answers, and they handle many of those every day. Our personal property and mobile home team, mobile homes, although they are residences, are classified as personal property, and so this team handles those, and they deal with regulation from the Department of Licensing as well as the Department of Revenue. And then personal property, a misnomer, I think everyone on the council knows this, but much of the public doesn't. It's a terrible name for business equipment tax. So not the inventory that a store would have, but their shelves, their cash registers, their signage, things of that nature is valued by this team and added to their property tax. Cartography and land maintenance, I mentioned. The old saying, invest in land, they're not making any more of it. It's kind of a true statement, but actually we are making more plats and segregations of land, divisions of property all the time. So the whole Tahali out there, which is in effect a new city that didn't exist a few years ago and is going to be an even bigger city, our people have had to map each and every one of those parcels precisely, and it's available online and it's used by many people, and it is required by law that this department do that. Next slide, foreclosure avoidance. Very proud of this team. They actually were recognized by the Standing Ovation Awards a few years ago because their goal is 0 foreclosures. We get very close to that. Sometimes the only properties we'll have in a foreclosure sale at the end of the year will be properties that nobody wants, that they thought they could do something with it, found out they can't, and they just let it go for taxes. That's really our goal, and we use a lot of tools to help people who have gotten behind on their taxes. When they're 3 years behind, that's when I need to notify them that we're moving toward foreclosure of their property. And we'll start the year with 1 to 2,000. When we go to auction, it will probably be 50 to 75. For the reasons I mentioned, some people just want to let it go. Document management, very important. We respond to the public disclosure requests, and some of them are serious and some of them are, as you probably know, they're, I won't say frivolous, but they're an attempt to extract revenue from the county if we don't do it right. So we have trained people who do it right whenever there's a question there. And of course, they're also keeping in electronic filing systems all the information I mentioned about all the properties. Levies is a small team, but very important. They work with each of the taxing districts and make sure their paperwork is in order for not exceeding the highest lawful limit. And without getting in the weeds, there are several different things that determine the maximum you are allowed to tax, and you must have everything in the proper form. So that's one reason that instead of getting one ordinance coming before you that will be for all the different taxes you collect, now they're going to have 3 separate ones come to you for general and road and conservation futures, because the Revenue Department has made a determination that is full compliance with state law. So even our fire districts that have a fire levy and an EMS levy are going to have to do 2 separate resolutions or ordinances now. Finally, information management, and that is that team of 3 people I mentioned who are using one of the great tools we have found in the last year and a half is Power BI from Microsoft. At very little expense, we're able to automate much more of what we do and be more effective in getting our job done. Our job does get bigger as the population grows, as more properties are built, and we're trying to do this without increasing in staff. So we'll go to the next slide. Our FTEs, I actually have an error on here. It's my fault. We showed 76.6. We very seldom have an increase in staff. It should say 77. We had one commercial appraiser who was working 24 hours instead of 40 hours a week. When that person left, we asked and got permission in the last biennium to increase that to a full 40-hour week. So we went from 76.6 to 77. As I mentioned, our department would be larger if it really had all the duties of a county treasurer. So this is the only county in the state that combines the offices of assessor and treasurer. Try to pay close attention to the parts that relate to the property tax on the treasurer's side, but then not so much to those things that are more the job of the finance department. So we are able to do the job with the 77 people. But there is a request we'll talk about before we're done. So let's go on to the next slide. Okay, this is the critical needs and challenges. The one that is ongoing, the council approved it 2 years ago, replacement of property tax administration system software by the end of 2024. So we got into this very quickly after it was approved and went through the RFP process and selected Tyler Technologies, which is the largest and leading company in the world, to my knowledge, in this field. And this is to replace the 24-year-old Ascend software. It's used by, I think, 9 or so counties in our state, but we're all realizing it's 23, 24 years old now. We'll be 25 years old by the time we're ready to replace it. And it's kind of like dog years. I mean, that's in computers, that is ancient. And it really does put in jeopardy when the state legislature makes a change in the property tax laws. Can the system do it? Does it have the ability to do whatever refinements they offer? And there are several bills pending that will come up in the legislature next year that could have to do with what's called the homestead exemption, for example, which is saying, well, we're going to help equalize taxes more by having you not pay at least the state taxes on the first, pick a number, but the number they're talking about now is high. It's $350,000 of value. You would not pay the state school tax on that, and that would shift the property tax to those people with more expensive homes and to businesses. And that's going to be one of the things that we really question whether our system could handle if that bill were to pass in whatever form. So that's why we need, and the council obviously saw the need for us to move ahead as quickly as we could on getting new software. And I'm happy to report we're well underway. They've assigned a good team of people for the implementation process. And it's going to be tough to meet that target the end of next year, but that's still how it's on the chart, that we will be ready to do our crossover. We can't do it any which time of the year we choose, because there are certain times when we're in process of using the data to issue tax statements, for example, and we couldn't do it then. We couldn't do it right at the deadline of collections of taxes either. So that's where we picked the time before the end of 2024. I'm going to throw this in. I think it's important for people to know so there's no confusion. I know the council has said that they're looking at things that may or may not have been recommended by the county executive. And that's why I want to make this distinction. When we submitted our budget, if you were to go back and look at what we gave to the county executive, we were required to submit a 4% reduction. And almost all of what we do is mandated. We can't not do it. So that would have amounted to, actually, I think the number was about a 23% reduction in anything that we have control over, anything discretionary. And that was crazy. I mean, you can't cut a budget 23% and still do your job. So that was frightening to us. And so the only way I could do my homework, if you will, and submit the 4% reduction was to stop this very important transition of the computer systems that I talked about. And we're well underway. We have meetings every week with our staff, and we're testing parts of it to see if the new proposals work and refining it. But I said, well, we're going to have to stop paying them their fees so that we can meet this 4% budget reduction. And it did meet it. That became enough to meet it. When it was added to what we had found a way to save about 0.75% in our budget. And I think that comes up a little bit later, that we'll detail it a little bit. But I just wanted to make this point. Please don't look at that budget and say, oh, well, that's what Mike wanted. That is not what Mike wanted. That's what I was required to submit. And wisely, I will say, the executive said, well, that's a bad idea. We understand this need, and if that's the only way to meet it, then you're not going to be required to do that. They restored that funding. Counting on us getting done at the end of 2024 and switching over, they did deduct $500,000 from our 2025 budget that was earmarked to pay for our current system, the Ascend system. Each of these has a sizable maintenance fee to continue operation. And fair is fair. That was a good move, because if we meet the goal, and we've told Tyler we must meet the goal because we don't have money to continue our current system in the proposed budget. But as you look at our budget, setting aside what we may have submitted to them, they made the right move. And of course, I guess some of the necessity for the 4% reduction, they were projecting at that time, and this was Gary's team trying to project what's impossible to project. Are we going to have a recession? And, how big is it going to be? And so I think the 4% has gone away for other departments as well. But for us, it was a very important decision to keep the Tyler system changeover moving ahead. So the second critical need and challenge that I want to mention here is adequate staffing of our exemption team to implement statutory changes to the senior and disabled property tax exemption. So we have 5 people who do this work, and those of you who are out as we were meeting people in the community with the SHAPE organization, you met them and you saw they know what they're talking about. They walked through the fairly complicated application, which is required by law, to make certain you deserve the exemption before we grant it. And they are already, because of changes that were made year before last, which allowed many more deductions. We didn't used to deal with deductions like the federal government does, but they put a whole list of medical deductions, and we now have to examine those to see what category of exemption the people fall into. So we got behind, all counties in the state got behind, some farther than us, but even today, with the 5 people working as hard as they can, we are running about 2 months behind to get those applications in. what happened, just to get to the point here, that sets the stage for it, but we went from roughly $46,000 being the maximum household gross income you can have to $64,000. So an $18,000 increase starting with the coming year, starting with 2024, looking back on what was your income in 2023. That's how we do it. We expect to flood more applications as we're still struggling to catch up from the deductions change in law. This will qualify, if you stop and think about people who are only on Social Security, how many more people would qualify at a $64,000 limit compared to what it was, $45,708 to be exact. So we believe the potential is at least, that's a 40% increase. We know we're going to increase at least 40% from we have 11,000 people on the program right now. So it's going to go up probably 3,000-4,000 just based on doing the math. I believe there's many more, and I don't have good data, but I believe there's many more in that particular gap there that will qualify, who we've had to say no to in the past. And we're doing everything we can to notify people. We want people to qualify, to get the exemption if they qualify. And the legislature, we ask them every time they have one of these changes now, and I know you've heard this through your WASAC organization. We have an organization called WACO that represents the other elected officials. We talk about unfunded mandates. So you're going to pass a law. It's a really good idea. But the burden, the workload on each county is going to be tremendous. So how are you helping us to do that? They're not. Zero. What they did is they said, well, we want to make sure everybody does know about it and apply. So originally they put $500,000 in the Department of Revenue account for advertising. Then they had a last-minute argument over the funding of various things and pulled some money out, as happens in budgeting. And they only put $200,000 into the advertising budget. But we get none of that. But this is the reason that I am asking for what I think is the very minimum, 2 more members of that team to go from 5 people to 7 people to try to serve that important part of the public. So those are our critical needs and challenges. We'll move on. Excuse me. Our department priorities: to equitably and efficiently value all 330,000 parcels of property in the county, to collect property tax revenue of approximately $1.9 billion to fund the diverse public services I've been talking about throughout Pierce County. Third, to perform all tasks mandated by state law and county code for the Office of Assessor-Treasurer in a thorough, accurate, and timely manner. And I want to say there, in the Revised Code of Washington, there are over 100 pages of very specific, detailed requirements for my department. And when you go over to the Washington Administrative Code, there's also over 100 pages there of additional refinements and procedures, reports, requirements on this department. So that is no small matter to simply say we want to obey the law in every aspect of our work, and that's the minimum we can do. We want to excel at it, of course. Finally, process all inspections, exemptions, appeals, and other taxpayer services with respect and compassion, guided by principles of equity and honesty. Fair and Equitable is actually the name of the magazine that the International Association of Assessing Officers puts out every month, and that's our guideline: fair and equitable. So we do. I mentioned the ratio studies. We break them down by stratification of the values of properties, so that are those properties that are between $250,000 and $500,000, how close are we to coming to the market value on those? Then what about the ones that are 500 to 750? And we compare that. We want to not be taking more out of one group of the population than another. And so that's important in our work. We'll move right on here. I don't want to stretch out this any longer than necessary. So next page. These are the budget decision package items by department priority. And as you'll see, the change that I put at the top, which is the only change that we are requesting from the county executive proposal, is 2 additional office assistant staff for exemptions processing. Fully loaded for 2 years, that cost is $337,500. This addresses our housing affordability and supply and our social justice and equity council priorities, because we will reduce the property tax payments significantly for the qualifying senior and disabled individuals, and reduce the tax payment to an affordable amount for each applicant. So we are meeting, I believe, those 2 important priorities. The next thing showing here was basically the reinstatement, as I explained, of the Tyler project. Push forward the funding not spent in 2022 and 23 to this biennium for one-time IT professional service fees and the increase in the software as a service fees. This new system, unlike our current system, will be cloud-based, so it becomes SaaS, software as a service, as opposed to virtual servers with backup here that have to be maintained by IT. So we're taking a burden away from IT and placing it on AWS, the company that does this work for Tyler Technology. That meets, as I've explained, very important goals for the whole county, not just for county government, but the public safety and the youth and young adults categories are met because basically without this ability to tax and collect, there are no schools, there are no fire departments. It starts here in our office, and we don't want anything to go wrong with that system. So I think it was a very good decision. This is pulling the money forward that has not been spent, is not projected to be spent by the end of 2023, and having that available moving forward. And then also, as I mentioned, what I put in the proposed 4% reduction was restored in the executive's budget already. But this is moving forward some funds we've already had allocated in the previous biennium, but we didn't know at that time what the timetable would be. They are making monthly installment deductions as they complete milestones of the work. Next item is increasing funding for billing and communications. This is mainly the cost of postage. They've had 2 postal increases, at least 2 in this year. I can't remember if they had one last year too. So it's 2 or 3 that have been imposed on us. And yes, we get good rates. We don't get bulk rates because we are sending individualized information to each person. It's not printed matter going out. But we do get a break on rates. And we use a vendor who is really expert at getting the very best rates we can. But even at that, we're expecting to spend $120,000 more in the next biennium. These other items are really the ones that we have no control over. They come through for software maintenance, our CAMA system, which is our other main computer system that is used for valuing each and every property. If it was 2 different departments, that would be the assessor's system, and they would hand it over to the treasurer's system. But we do both. Incidentally, this year is when we will be in Lakewood and Steilacoom and University Place, mostly Councilmember Hitchens' district, DuPont, Anderson Island. No, not Anderson Island. We've moved that over just to balance out the numbers, we moved that over with Fox Island and the peninsula. But the whole southwest corner of the county, our residential appraisers, they're now meeting there'll be over 50,000 properties they will look at and value this year. So we need the CAMA system. We need to pay those fees. These charges come to us from the budget department, budget division of the finance department, as they are determining the amounts they will charge each department for various services provided. So we basically rent our space from facilities, and fleet provides we have 33 vehicles we use. They're estimating about $84,000 increased cost in the biennium. So that's a bigger increase than we've seen. We suspect it has to do with they're proposing 2 of our vehicles near the end of the biennium to be electric vehicles. That will happen when the terminals are there, the plug-ins are available in what we call our car cage at the annex to plug them in and charge them up. But in looking forward, I'm sure it's going to be more expensive for vehicles in the future. And I know in a different part of the budget you're going to hear about, if you haven't already, facilities will present the cost of actually wiring that system, because apparently Tacoma Power's ability to add that much electricity doesn't exist at the annex, so they have to do a whole lot of rewiring, and that's a big one. I think a 7-figure type thing, but that has nothing to do with my budget, thank goodness. There's the good news at the bottom here. This is a change in the budget. Our fees, we do not charge the various taxing districts for collecting taxes, so you don't get a bill from us, nor does any of the cities get a bill for that. But we do charge for what's called fire benefit charges. We also are paid by the Conservation District and the Noxious Weed Board for collecting their fees, which are not taxes, because they're not based on ad valorem, on the value of your property. It's convenient, and the state has decreed this is the way it will be done. Since we're sending out bills already, we bill for these various other districts. We do not charge the fire departments for the taxes, which is up to $1.50 per thousand for fire and 50 cents per thousand for EMS. But if they choose to take a reduction in their tax amount and go to a different system that is actually based upon the type of construction, type of use, likelihood of fire damage and things like that, that's called a fire benefit charge, and it is not a tax, but we still collect it. And we are paid 1% for collecting it. So that's the main reason we are projecting increases in income of about $270,000 in the next biennium. So that's on the plus side. It's another service that Pierce County is performing for those taxing districts when they choose to do something other than taxing. And it started with Central Pierce Fire District. It went very well for them. They raised more total revenue that way than they did with the taxes. They give up 50 cents of the fire tax, so it's $1 instead of $1.50. Then they collect more in this fire benefit charge. And so both Graham and Ording have now gone that direction, so it's growing, and there may be more to come in the future. Next slide, please. The proposed changes in FTE I've already mentioned, and I've mentioned the exact reason why. We know that we are going to be bombarded with new applications. We still feel a responsibility to validate everyone. Once a person gets that exemption, they're required to notify us if there's a change in their income but on a 6-year cycle, we do not requalify them. They get a little letter from us that says, remember, if your income changed, or if you no longer own this property, or if it's no longer your primary residence, you need to contact us. But when they get an exemption, it's actually good for 6 years before they have to renew it. So those are very valuable. They, in essence, cut the value of your tax bill in half. And if your income is extremely low, it cuts it more than that on a percentage basis. It takes away from the actual value of your property. And during the years we had the rapid rise in value of residential property, your value is also frozen. So that's not as valuable a thing now as it was a couple years ago when values were skyrocketing. But still, they are frozen, or if their value should ever drop below the frozen amount, they pay the lower amount. So it's a very valuable thing. We know thousands of people are going to want it and need it, and we want to meet the need, but I believe 2 people added to that staff is just the bare minimum to do the kind of quality job that I know you want us to do on behalf of the county. Enough said. Next page. Unlike the health department, I have nothing to report. We received $0 from ARPA directly, and we plan to spend $0 going forward. So that was a quick one. Diversity, equity, and inclusion. How have we applied our principles to the budgeting process? Our request for additional exemption staff will enable us to better serve disabled taxpayers, and that in Pierce County especially includes many military veterans, and to serve the low-income seniors as well. Are there specific areas or programs we've implemented to advance equity consideration? Our hiring practices have resulted in a much better reflection of Pierce County's population among our employees. That is an ongoing thing. We don't hire people because of their ethnicity or any other factor other than what we perceive as their ability to do well at the job. However, we have spread the net as wide as we can, and we always like to see, and whenever we have the opportunity, to hire various underrepresented populations. So one good part of that is on our staff now. When we have people come in, we always have had a translation service. We can hook people up by telephone. It's a little cumbersome. But if somebody comes in either Spanish speaking or Korean speaking, 2 of the very large groups in our county, we've got staff right there, more than one of each of those categories, ready to go and help them directly. But of course, more than that, we're wanting our population of staff over time to better represent Pierce County's actual population. What steps have you taken to ensure the department budget doesn't cause disproportionate harm to any groups in our community or perpetuate existing racial inequities? Well, we, as I mentioned, we follow our Bible, if you will, is the Washington Administrative Code and the Revised Code of Washington, and it absolutely requires us that we apply the property tax law to every property owner equally. In most cases, I guess we could take a guess, but we don't know the ethnicity or gender or anything of the owners of the properties. The tax is based upon the property value. How have we engaged with or considered the needs of underserved communities and or BIPOC communities creating the budget? Well, outreach in person, through media, by mail, and online. We're always trying to extend the awareness of our services to everybody. So we'll go and speak before groups of various types, and we keep a very good website. Our website, I think I've mentioned this here before because I like to brag that it's by far the #1 site visited in Pierce County. Many people use it in their work, but the taxpayers use it for information, and we're using it to disseminate the changes in the exemptions so that we don't miss anyone. Those are some of the ways that we achieve that. Okay, and finally, we're getting close. 2 pages, okay. The budget reductions, we did, when we were doing the exercise of trying to cut the budget by 4%, we were able to cut 0.75% in areas where we may have had funds that we don't expend every year, or if we anticipated some change. So the first one is kind of a no-brainer. One of the things we handle is the utility local improvement districts, ULIDs. Well, they're all paid off. There aren't any more right now. There may be some coming before you in the future, but at the moment, the ULIDs, we don't have to put staff time toward making sure those funds are collected, which can be subject also to foreclosure. So it's small, but there's $4,000 saved. Our cellular communications, we had to beef up during COVID, and rather than just keep it beefed up, we're paring it back now. So the cell phones for telework, we had to use them during the pandemic, but it's going to save $5,000 by not using as many as we were. In records management and storage, as we store digitally, we've done a lot of work. The Open Text project, I don't know if you've heard about it, it's spreading countywide. It's an enterprise software that was purchased by the county. We were one of the first to get everything onto Open Text, so our record storage then drops by over $20,000. This next one was reallocated to IT, is part of the pre-calculated cost that comes to us that we pay for IT services, like we pay for facilities and the other services provided to every department. So that's a good size one, $87,000. It isn't necessarily going away from the county's responsibility, but it's going away from our budget. Intergovernmental Services, a WACO organization, I mentioned, we belong to that. I'm actually a board member, active in that, representing, in my case, all the assessors in the state. And that was, for some reason, and I might even say inadvertently, put in our budget. I don't know exactly how it happened, but it now is a central budget item that is allocated to those different departments that I mentioned that qualify to be members of WACO. And by the way, Connie, our county clerk, came to the WACO convention up in Everett this year and got involved, even ran for an office. She wasn't quite successful, but I'm really happy to see other departments getting involved in that organization. But it is a county level budget item now. And then the Ascend Property Tax Administration System software is a big one. Because again, if we stay on schedule with the Tyler project that was previously approved and we roll those funds forward and we don't put it on hold, which we don't want to do, then by January of 2025, we will no longer need Ascend. We can unplug it. We actually have to notify them 6 months before that per contract, but we'll let them know we're not going to need your services any longer, and we will put that 25-year-old software to rest. Okay, the last page I have here is the rollover, which we've already talked about, so I don't need to read this and go through it. All the funds that you made available for the whole Tyler project, it was put in last year's budget, and now it's going to be rolled forward, and it's sufficient to do everything we've identified so far. We think we were pretty thorough in the RFP process and in the pre-contract process, that we anticipate we've got it covered, and we're not expecting and will not welcome any cost overruns. So that's just a matter of using funds that we already budgeted and did not spend in 2022 and 23. And I have finished my presentation, unless there are any questions.
Well, thank you, Mr. Assessor-Treasurer. Are there questions for Mr. Lonergan? Mr. Lonigan, I just wanted to ask one question. You did a very good job expressing the needs, functions of your department, and the many responsibilities you have for the taxpayers and to run local government. And I think you made the important case for the office assistants. You made your case very clear for the need for the new staff.
Yes.
Because of the what you anticipate to be the increased low-income disabled individuals who qualify for that property tax exemption. I just wanted to, I'm just going to ask about two areas. I think what you shared with us is right now with the current exemption levels, I think we heard your staff working as hard as they can are 2 months behind with the current volume of work.
Yes, at one point, we were 5 months behind. I know that King County was 8 months behind, but now we have whittled it down. Yeah.
To 2 months. And you're because of the state law changes, new exemption levels, you're expecting a 40% increase to the best of your knowledge?
I think a minimum of 40%. I believe it's going to be higher, but that one statistically makes sense, yeah.
And you said this, but we have to ask because it's hard to find new money to spend on however important the item is. There's no way to automate this. Have we looked at ways to automate some of the functions to try to lessen the cost?
Absolutely. And it has been much more of a paper function in the past. We have now, and this is within the past year, we've always had the ability, well, for several years, we've had the ability to print a PDF of the form on the computer, on our website, and then, of course, fill it out and send it in by one form or another. That's pretty 20th century, and we realize we're in the 21st century. So in the last 3 months, when you go to our website, it says, here is the link to download the fillable form, complete the form, and then submit it to us. So we now are where we should be, and that alone, right now, the last I heard, we were getting about 30% of our applications that way, which is pretty spectacular for us. And the really good thing about that is the reason these things take so long, it isn't just reading the form and everything's fine. There are, by law, required attachments. If you file a federal income tax, you have to put your Form 1040 there. If you don't file federal income tax, you have to show 2 months of bank statements that would show other sources of income. And people don't make the attachments. Also, people miss questions and skip and don't give you information. So then we are recontacting those people, and this is more common than not, that it's not just we handle the form once. We have to send a letter or call and ask them to submit more information, which eventually they do, but not always right away. So it's not quite as simple as it might seem. But the blessing with the fillable form, of course, as you fill them out, you can't skip something. So, and even the attachments, it tells you should be putting these attachments on. Now, are they going to, send us their laundry list instead of their bank statement? It's possible, but we're specifying clearly what we need to do the job, and we're getting more that are able to be handled one time and make the decision.
Thank you for explaining that. Mr. Boki?
Thank you, Chair Mello. So I just want to follow up and make sure that we're all on the same page here. The decision packet has add 2 new office assistant to support people. That was denied by the executive. But in the budget book itself, there are 2 new office assistants this year in the budget, but 2 less appraisers. So are you asking for 2 additional beyond the 2 that you have already added?
No, I guess I haven't seen that. I haven't gone through the budget book, so we only.
Okay.
You're saying it's saying.
Yeah, it's going from 25.6 to 27.6 office assistants, but your appraisers are going down from 36 to 34. So you already have
Let's
two
show
new
Mr.
office-
Lonigan the budget book after, when we
yeah.
break, and let's make sure he can
Sure.
reconcile.
We're not proposing any reduction in appraisers. I'll say that we're not proposing an increase either, but we actually did convert one position this year that was an office assistant. When we had a retirement of an appraiser, we moved that position over to the appraisal side. So if anything, it's going the other direction just because of the increasing demand. But the only request we're making is for the two office assistants in exemption, so I'm puzzled.
Okay.
Thank you. Mr. Lonigan, I'm going to ask you to huddle with Mr. Boki and Ms. DeMuth afterwards to make sure the staff summary is accurate and that we're tracking the FTEs
Good.
appropriately. Councilmember Hitchin.
Thank you, Chair. That was one of my questions. I was trying to track that as well and saw one going up and one going down. The other question I had, Mr. Lonigan, is around the new technology. Will the Tyler platform support people trying to apply for exemptions or no?
We don't know for certain. Everything we will ask Tyler to do. There's other software also available, and we've looked at it, but we haven't felt that it justified the cost. It wouldn't have speeded up our system enough. So a lot of what we're doing now is more automated than it used to be, and we're actually, as I mentioned earlier in my presentation, moving people from one team to another when possible. We've become very aggressive about that concerning the exemptions, and when it isn't tax payment time, April and October, those teams do slack off, and then they get really busy again also in June when I send out the new valuations. So they're at full tilt, and I wouldn't ask them to do another thing because they've got people lined up waiting during those times. But we're cross-training those people to do more of the exemption work right now, and we've taken some things out of the exemption office. We have one employee now who's specializing in refunds. Every time a decision is made by the Board of Equalization, every time we detect an error, and every time somebody does qualify for an exemption, no matter how long they wait, it goes back to the time that they applied. Even if they did have to wait 2 months, it goes back to the time they applied. Issuing refunds is a very time-consuming thing, and so we've taken it out of the exemptions team where it used to be and dedicated a person to that. So those are the things we're doing to help answer the chair's question too, trying to make it work better, but we're not sure yet whether Tyler does have a module that deals with exemptions, but whether that will be usable for us, whether it's better or worse. We're going through each aspect of our work and seeing what Tyler has to offer that could be an improvement.
We'll see what the state laws do to us, and we may have a different opinion about how much we want to automate this.
There you go.
I appreciate the clarity, and whenever we see it in our budget book, it just says office assistant, but I know that I've talked to some of your office assistants. They all have very different specialties and different jobs, but we just classify them all as one. So it's good to kind of hear you remind us that, they have different specialties and different
And that's a whole different meeting I would love to have with you sometime, but not today.
Okay, thank you. Thank you, Chair.
Thank you. Mr. Lonigan, one last question. In your organizational chart that you share with us at the top of your presentation, you have a box that shows a deputy assessor-treasurer, not vacant position, not filled. And in the staffing summary in the budget book, which I think you have not seen yet, there is no deputy assessor-treasurer. Is that it's not only vacant but unfunded. Is that your understanding?
Yes. And just to take a minute, 11 years ago when I came into office, we were in a budget reduction layoff situation coming out of the 2008 to 2012 housing debacle Anyway, one of the first things I was informed of, one of your first duties is going to be to lay off this person because they're next on the list. And I said, well, that's not a good way to start. And this happened to be one of the internal IT people that we need very much. And I said, I have not yet chosen a deputy, and that is, outside of the civil service system. It's an at-will position. I said, I will forego the deputy rather than start my career here by laying someone off. So that's how it happened, and it really hasn't changed. The demands have been such that I've never had the luxury, if you will, of a deputy. Most assessors and treasurers do. Many people in the county department heads do, but I have 6 direct reports, and I have weekly meetings with each of those key people. And I think some of these things are things that a deputy might do, but no, I realize it's not funded. I keep it on the org chart. I don't want people to forget. Someday someone will be replacing me, and they will have, I think, the right to have a deputy. They'll have to shoehorn it into the budget somehow, but I don't want that to be forgotten. That's why it's there.
Thanks for explaining that to us. In closing, I not only want to thank you and all the public servants that work for you to, do this kind of work that's often unnoticed, but absolutely essential to running local government. But I want to give an extra special thanks to the emphasis you've given to the senior and disabled property tax exemption program. We ask that you and your team spend some extra energy helping get the word out, doing in-person workshops, as you noted, throughout the county. This has taken a significant amount of your time and your team's time, working with South Sound Housing Affordability Partners, partnering with many of our offices to do that. And it's made more work for your team, but it's got the word out for people who are eligible for this when they qualify. So thank you for hearing that need and partnering with us to continue to be innovative in how we get the word out and make
Our
it easier
pleasure.
for people.
Yeah. Thank you.
Thank you, Mr. Lonergan. Are there, I'm at item 6, Councilmember discussion, questions, and comments. Are there any by members today? We will spend a lot of time in retreat going through reflections from budgets and talking about what council priorities are missing and what of these requests we wish to fund. So there is a lot more discussion to be had, but always want to make sure we pause to see if there was any immediate impressions or immediate questions that we needed to make sure didn't get asked during the actual presentations. I'm not seeing any at this time. So we're approaching, as we approach our budget retreats, we're really looking to have all of council's questions answered going into the budget retreat. So I just want to remind members, if you have questions about the departments we heard today, please get them to Ms. Chapman or Mr. Boki by close of business tomorrow. The turnaround times are getting quicker and quicker around here. Close of business tomorrow to Mr. Boki or Ms. Chapman. They'll get it to the appropriate departments to get the questions answered in a timely way. Seeing no other business before the Pierce County Council and the Committee of the Whole, we are adjourned. Come on up and take a photo with us if you